Welcome to the Afterspin, opinions from thought leaders in our state. I want to ask Rob Schofield and John Hood. State Treasurer Dale Folwell administers the state health plan with some 730,000, I think to be more specific, current and retired state employees. Now, he asked UNC Hospitals, which is the largest health care provider to the plan, to give him a detailed list for the cost of procedures. What he got was the state contract that was so heavily redacted as to be unusable. A, was Folwell wrong to ask for the list? UNC said the information was proprietary. B, were they wrong in not providing it? And how can we reduce cost if we don't know what health care costs are, Rob?
Well, Treasurer Folwell is a very effective media user. He likes to get his name out there. He likes to come up with provocative new ideas. This is another example of that. I don't have any particular problem with him asking for this information. I think it's good that we have more transparency in our healthcare system, but we ought not to harbor any illusions that this is what's going to solve the healthcare cost problem in our state. Consumers don't shop for the basic healthcare services that are driving up our costs. They don't shop for emergency services, long-term care. They don't shop when they're at the end of life. And the notion that we can somehow get a handle on costs in healthcare by exclusively by making prices and costs more transparent, I just think is a silly notion.
Should they shop for healthcare, though, John?
I know John thinks they should.
Well, it's not a question of should, they do. Of course they do. If they can.
Well,
and the problem is, if you don't have any posted prices, you don't have any idea what something's going to cost, you can't make a comparison. Now, the argument from the institutions, the Blue Crosses and the big healthcare institutions is, well, we are the ones. We're basically acting as agents for either the consumers or the providers, and we're trying to negotiate all this out, and some of this has to happen behind closed doors or has to be redacted.
So trust us.
This is a serious problem. It is certainly the case that when you're in the midst of an actual emergency room care is not a huge part of the driver of healthcare costs, actually, but it is part of the story. Much greater is the end of life, things that actually unfold over months or years.
That's right.
And those decisions can be made ahead of time based on price. They frequently are not. And that is because you have absolutely no idea. When I went through my health care of my wife a little over a year ago, we had some very major decisions that involved tens of thousands of dollars of expenditures, some of them ours, some of them the insurers, and we had absolutely no transparency at all. Should we go to this hospital or that hospital? I asked. They don't know. They don't know how much it's going to cost.
Right.
This is a completely uninformed system. Now, in other countries, they do ratchet the cost down. They just do it mandatorily. They just make doctors and hospitals and nurses get a lot less money. They just pay them less. And that has other consequences.
But Rob, it's probably the only area of life where consumers don't have any choice.
Well, there may be a few others, but I mean, the notion that I just think it's pie in the sky to think that we're going to get average consumers to shop. John's an extraordinarily well-educated man who thinks about these things, but the average person who gets sick, gets a diagnosis of cancer, or breaks their leg, or their mother's dying with a chronic illness is not thinking, gee, how can I do this in the most, people want to be saved. They want their health to be improved. That's the first thing at the top of their list. Spend whatever it takes. I think we'd have much more success in driving down healthcare costs in the state if we would expand Medicaid. Studies show that actually would drive down more premiums than worrying about trying. I mean, I'm all for the transparency, but I don't think we should harbor the illusion
I come from an era in which when Mama took me to the doctor as a boy, at the end of that visit, she pulled a $20 bill out and paid the doctor. We knew what it was costing.
I thought you were going to say she pulled the chicken out of the bag and handed it to the doctor. Isn't that how things were back then?
This is just not going in a very good direction, so I'm going to thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.